Hi, I'm Vicki Liviakis. Welcome to Body Beautiful. This is a show where we talk with local professionals about the very latest in cosmetic procedures and medical devices. We also take your calls live on the air. With us today, we have plastic surgeon Dr. Joseph Mele, and later we'll be taking your calls, answering any questions you might have about rhinoplasty. We'll explain what that is. Here's the phone number, 800-440-4884. We'll also be posting the phone numbers to the guest office, so be ready to jot that down. And before we get started, our little caveat, we always give you any advice you receive medically, you certainly want a second opinion. Consult your own physician as well. Well, let's jump right into it. Welcome back to the program, Dr. Mele.
Thank you. Nice to be here. Good morning.
Rhinoplasty, the more common term is nose job, isn't it?
Correct. Yeah, most people call it nose job or nasal surgery.
We talk about rhinoplasty, we think of rhinoceros. Obviously, it's something with a pronounced nose.
It's the Latin root, so it means nose.
We talk about a lot of plastic surgeries on this show, and the one thing we haven't talked about a lot of is rhinoplasties.
Well, it's about time then.
Well, and we're so glad you're here to talk about it, to clear the air about any misconceptions we might have. It seems that it's fallen out of, I don't know, not favor so much, but it's not as popular as other forms of plastic surgery.
Yeah, and it's not because we're doing fewer rhinoplasties. It's because we're doing more of other stuff. So yeah, it doesn't get talked about as much. We do more breast augmentation, liposuction, eyelids, facelifts. We tend to do more of those, but we still do a lot of rhinoplasty.
Well, and I also wonder if the techniques have changed so that it's not so obvious, because back in the day, 50s and 60s, if you did a nose job, it was pretty obvious. Everybody came out with the same cookie cutter nose. It didn't, you didn't move with your face.
Well, no, it should belong with the face. And I always try and tell my patients, when we sort of can model it on the computer, is that I don't want to give you someone else's nose. I want you to have your nose still, but we just want to get rid of the parts that are bothersome.
But don't people come in and say, I want Angelina Jolie's lips, but I want Jennifer Aniston's nose? Or something to that
and
effect.
If you put all those parts together, it would be one strange-looking human being, because Angelina's lips work for Angelina, and Jennifer Aniston's nose works for Jennifer Aniston. It's the proportion. It's how it plays on the rest of the face, how it relates to the cheeks, the chin, the forehead, and all those parts need to match. And if you just take a different part and put it on the face, it's going to look a little odd. So,
have our sense of aesthetics changed over the years as well, that somehow we're, say, to look at a nose like this, that you know, we're accepting the fact that, well, it's pronounced, but it's definitive. It's got character.
And it may be part of the family. And I'll have patients who come in who have a large dorsal bump, and they love it. Everyone in their family has it, and it's the tip that needs to be fixed.
The rhino of the rhinoplasty.
Well, that's why it's important to talk with your plastic surgeon and tell them what parts are bothersome. Not that you have to make the decisions in terms of how the procedure's done, but the patient, for me, is very important, helping to guide me in terms of where I want to go with the nose.
Are there any, let's see, more advanced techniques that are being used, or are they pretty much tried and true?
There are a lot of tried and true methods that work very well. And there were really two schools of thought with rhinoplasty. There was a school that took stuff away and reduced, and there was a school that built things up. And I think the combination of the two has really given us a lot of tools, a lot of different tricks we can use to kind of get where we want to get with the nose. That being said, there are still areas we can't fix very well, and we still need to make some improvement on.
Okay, I may be a bit behind the times. You mean you're actually adding to noses? It seemed like everybody wanted to go the other direction of making
and that
small.
was the sort of the traditional nose job, was to reduce, 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 and carve down so that what you're left with is the perfect nose. And there are even little models made that you can buy, or I can buy at a plastic surgery convention, that show me where the cartilage should be in every single nose. I think if you do that, you will always get a good result, but you won't get a great result. I think to get a great result, you need to tailor your approach to that particular patient's face.
Okay, well, all right, then that opens up the can of worms, so to speak. I mean, you've got, then where are you getting these parts to add on to the nose?
Sure. Usually, we're using the parts that are already in the nose. So we'll use cartilage to make grafts. If there's a tip deficiency and we're trying to build it up, we may borrow some cartilage out of the septum, out of the inside of the nose, way back in the back where you don't notice it missing, and use that to make a strut and give the tip support. There are areas on the upper part of the nose, if it's indented, again, we can use cartilage grafts in those areas too.
Okay, this is getting interesting, and I know we have some photographs that we want to take a look at. Plus, I have an inside story about a rock star and some septum that was rebuilt for them. Oh yeah, I'm sure you've heard of those too. I will tell, but first we need to go to a break. For more information about Dr. Mele, you can call him 925-943-6353 or check him out on the web at drmele.com. And we're going to be taking your phone calls and continue our talk about rhinoplasty when we come back on Body Beautiful.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor.